Hi, I'm Ashley Cohn, and I'll be presenting on heart failure management education, a self-care approach. Cardiovascular disease is a leading cause of death, with death due to heart failure increasing. A patient's prognosis after being diagnosed with heart failure depends not only on the physician's care, but largely on the patient's ability to adhere to self-care behaviors. Some of the most important self-care behaviors are recognizing and reporting symptoms of heart failure, adequate exercise, diet modifications including sodium and fluid restriction, and maintaining a healthy weight. Adherence to self-care behaviors can decrease hospitalizations and improve the quality of life for heart failure patients. Adults over the age of 55 years old diagnosed with heart failure are a population of interest because they often feel as if they lack the resources to be able to maintain the necessary self-care behaviors. Health literacy, which is someone's ability to understand and use the health information they are given, and social support have been identified as important aspects that help this population in maintaining the necessary self-care behaviors. To understand how we can improve self-care behaviors in older adults with heart failure, Orum's theory of self-care will be discussed. Dorothea Orum was a bedside nurse, an author, and an educator. She taught at the Catholic University of America, where she served as the dean of their School of Nursing. Her self-care deficit theory of nursing was first presented in 1971 in her book titled Nursing: Concepts of Practice. Orum identified 5 methods of helping: doing for others, guiding, supporting, promoting personal development, and teaching. Orum proposed that individuals will perform their own self-care activities as long as they are able in order to maximize their overall health and well-being. When their self-care demands are greater than an individual is able to manage on their own, that's when they will seek professional care. Older patients with heart failure are likely to experience self-care deficits due to the demanding nature of the disease. Heart failure requires continuous medication and lifestyle adjustments to minimize complications and hospitalizations. Orum's theory empowers patients to care for themselves and clarifies the role of nurses when they are unable to do so. This framework has been applied in nursing practice and administration, substantiated through nursing research, and used as a framework in nursing education. Orum's theory has been applied all over the world across many different healthcare settings and has been used to develop further nursing theories, speaking to its reach outside Orum's circle of contagion. Matthew and Thucka found that for older adult heart failure patients, printed materials regarding symptom management and self-care was generally inadequate. They proposed that individualizing the standard education resulted in increased knowledge and understanding of heart failure treatment regimens, and that using the teach-back method can help providers identify knowledge gaps and deficits. This article reinforces Orum's self-care deficit theory as it relates to teaching. When patients truly understand the implications of lifestyle changes and adherence to medication regimen, they are more likely to participate in self-care activities. This study was performed in a post-acute care unit, but could be translated to the outpatient setting, especially during follow-up visits after discharge from the hospital for heart failure-related complications. Joe et al. Investigated the relationship between health literacy and social support, and how these two corresponded to a patient's adherence to self-care behaviors. They found that social support helped older patients with heart failure navigate and overcome barriers to continuously performing self-care behaviors. The association between health literacy and self-care behaviors indicated the importance of developing education programs at a level that all patients can understand and follow, regardless of their level of health literacy. This study effectively applied Orum's theory of self-care by identifying 2 self-care deficits common in this population and investigating how they impact self-care behaviors. This information can be applied to patients over 55 years old diagnosed with heart failure in an outpatient clinic by incorporating identification of social support systems as part of a patient education program and assessing health literacy to adjust teaching to each individual patient. Hamash et al. Sought to further investigate the relationship between social support, self-care confidence, and self-care behaviors. They found that self-care confidence actually has a greater impact than cognition on heart failure self-care activity performance. They also found that greater social support contributed to greater self-care confidence. This study focused on the supporting others aspect of Orum's theory. In the outpatient clinic, this translates to providing praise and encouragement for aspects that are performed well and focusing education on other self-care behaviors. In the older population, receiving support from your provider is especially important because these patients may struggle more physically to perform certain aspects of self-care and can benefit from the reassurance that they're performing some aspects of self-care successfully. The proposed project would implement a standardized education program regarding heart failure to address self-care deficits. The population would be male and female patients over 55 years old diagnosed with heart failure who have regularly scheduled appointments in the clinic. After 3 months, the patients that choose to participate will be compared to other heart failure patients in the clinic based on hospital admissions, perceived social support, and ability to adhere to medication regimen and make appropriate lifestyle changes. First, participants will be enrolled and assigned a patient number to keep their identity anonymous, and all appropriate consents will be signed. The pretreatment questions will be designed to assess social support, health literacy, and their initial ability to adhere to medication regimen and lifestyle changes. This will be given to all patients seen in the clinic diagnosed with heart failure. Those who choose to participate will be scheduled for information sessions once every 2 weeks for the first month and then monthly. Based on their pretreatment questions, the standardized education plan will be tailored to their individual level of health literacy, and information on strengthening their social support system will be integrated based on need. After 3 months, all patients diagnosed with heart failure will again be asked to answer the same set of questions. The change in the answers will be compared between participants and non-participants, as well as the number of heart failure-related hospitalizations and reported adherence to medication regimen and lifestyle changes. If the intervention isn't effective, then we will see an increase among participants in perceived social support, an increase in patients' ability to care for themselves and adhere to medication regimen and lifestyle changes, and a better understanding of heart failure and the importance of self-care. Here is a list of references used. Thanks for listening.